My name is Olive Mkwinda. I'm a second-year radiology resident with the QUHES radiology program. So the weekly Gynaecology Oncology MDT is a meeting where we discuss different female patients with gynecological cancers within the hospital. These are mostly cervical cancer patients, ovarian cancer, and any other gynecological malignancies or suspected gynecological malignancies that are there. So there are three teams: the Gynae team, the oncology team, and the radiology team. Most of the times we discuss staging of the patients to see how advanced the cancer is based on their imaging findings. But we also sometimes discuss patients who were suspected to have cancer but end up having another diagnosis based on their imaging findings. So my role in this MDT is to upload the images on a platform where the gynecology radiologists from UK through teleradiology are able to review the images, and then to coordinate with the team here and them in terms of the meeting times and everything. Having a remote gynae radiology specialist involved in the MDT has made a difference because it's allowed us to review more of the cases. Since we only have a limited number of qualified or consultant radiologists on the ground, we're usually not able to cover all of the numbers. Even if we review the cases, we wouldn't be able to show them in time to have a structured report ready in time for the MDT. So having a specialist designated to support us each week has allowed us to review more cases. And aside from that, it's also allowed us to have a specialist opinion on different findings that are specific to gynae images. For example, if we were to review the same images with just a consultant radiologist, they'll be able to probably give us the same information, but for the specialists, they are able to also speak from their experience working in the field for a long period of time, and they're able to clear out some questions that would otherwise have remained unanswered if we weren't able to have their support. Some of the changes that the gynae, oncology, and radiology MDT discussions make are mostly to do with the management of the patient based on their staging. So from the imaging findings, you might say that a patient has advanced disease and wouldn't benefit from some of the treatment options that might be offered. Or for other patients who were suspected to have very advanced disease, from the discussions, you're able to discover that maybe the disease is only limited to a certain area and they're therefore able to benefit from certain management options. Aside from that, for patients who have unclear diagnosis where they are not sure if this is a certain type of malignancy, the radiology specialists, the gynae radiology specialists are able to give insight onto what would be more likely a diagnosis in a case that is not very clear. So some of the things that me and fellow trainees have learned from participating in the gynae, oncology, and radiology MDT are, for example, strengthening our ability to do a staging of particular cancers. So aside from participating in the MDT discussions, the specialist gynae radiologists usually also give us some teaching after the discussion on the cases that we've gone through. So they'll take us through how to identify different things, as well as how to overcome some of the challenges that we would face in reporting those cases, and different weak areas that they've noted. They'll be able to guide us so that we should improve our reporting skills. And we wouldn't have been able to have this without the support of the specialist gynae radiologists. So the biggest challenge that I've perceived in the imaging of gynecological cancers here at Queen's is the delays that are there in obtaining CT scans and MRIs. The patients might have initial ultrasounds and chest x-rays done on time, but for them to have a CT for staging, it might end up taking a few weeks to get it booked, and after that it will also take a while for that CT or MRI to be formally reported. To solve this challenge, some of the things that would help would be an increased number of radiologists to report the imaging of the patients, and aside from that, increased access to the different imaging modalities. For example, at this point, most of the patients within the southern region with different gynecological cancers will come here for the imaging, and this leads to multiple delays, and we're only looking at the gynecology patients, but throughout the hospital there are also other patients who are all relying on this one machine that is there. So after the completion of this collaboration, I'd hope that we can continue to have gynae, oncology and radiology MDTs, where we continue to discuss patients, and hopefully that would be able to do it at a larger scale than we've been doing now. So we currently usually discuss a maximum of 6 patients per week, because that's feasibly what the logistics would allow. But hopefully we'll be able to upscale this as we've learned and we now have the confidence to report, and would be able to create a more sustainable way of continuing the gynae, oncology and radiology MDT. For patients, I'd hope that we'd be able to report their images sooner, and that this would translate into faster management of the different malignancies that they have, because this will also translate into better outcomes for the patients if they're able to start their treatment sooner. Creator Fellowship supports specialist training by providing funding which is used for tuition for the specialist training programs, which are usually quite expensive for somebody to afford by themselves without support. Aside from that, they also support in building research capacity. So they would give you a supervisor from MLW to mentor you in research and help you in choosing the right topic, as well as making not just a research project as a thesis, but something that is like of good quality in terms of the project. And they would also allow you to attend some of the MLW trainings for research that go on, whether to do with statistics or other things like that, that would strengthen your capacity to do better research. Aside from that, the Creator Fellowship also allows you to participate in the activities of the various research groups. So the specific research group that you would join based on your project that you are doing. And this allows you to have exposure to projects that other people are doing, and to understand what different things require in the research field. And this gives you further exposure to be able to do more within the field.